And with my own PCP, she actually said to me one time when I was at 0.38 on Klonopin, she goes, "You're so low, why don't you just jump off?"
How do you feel about the future?
Well, of course, first thing I'd like to do is be off of this, and I'd like to be one of those lucky people that get better. I'd like to be able to travel. I'd like to just not be sick.
When that older doctor was retiring, said, "Oh, I've got another colleague. He's happy to just keep on prescribing this. He'll be around for a long time." What would you have done?
I think I would have stayed on it. That's how much it's changed my life.
Hi, I'm Dr. Josef Witt-Doerring. It is my pleasure to be joined today by Janice. Janice is going to tell us what it's like to come off Klonopin after being on it for 35 years. And so, Janice, thank you so much for agreeing to come on and talk about this experience.
You're welcome. Thanks for asking me.
Yeah. So I think, 35 years is a long time to take a benzodiazepine medication for. Before we go into the difficulties you've had with withdrawal, which we're going to cover, I like to start things off chronologically. What was happening in your life for you to end up taking benzos in the first place?
Well, I never even knew what they were. I was depressed. I had depression. And I'd had that on and off after my first child, but, that was years before. And so it was like it was in the early 80s. And I found this psychiatrist. I'd seen other psychologists, So I went into a hospital. At that time, the hospitals were private, exclusive, nice places, where you went for 4 weeks. It was like being in a hotel. A really nice place. So I went there, and that was here in Virginia somewhere. It's not there anymore. And after about 11 days in the hospital, the doctor, they assigned me a doctor, and he put me on imipramine, I think it was. I have to really go back in time. And this from somebody that's never taken medication. My mother was scared of drugs. I was. I never took anything other than baby aspirin. But so I took that, and then he put me on Xanax. The Xanax was wonderful. So the real reason I was in there, aside from the depression, was I had diagnosed GAD.
Okay.
And I had panic attacks in my past. So they put me on Xanax, and it was wonderful. Everybody loved it. It was like a high. So after a while, the doctor said, "Well, we can't keep you on this. We need to put you something on that's not as short, a short half-life." So he put me on Klonopin.
Sure. Mm-hmm.
And after I went on Klonopin, then it was amazing. I could drive. I didn't have any phobias, but the depression continued. Mm-hmm. So I went on a litany of medications, one right after the other. Fortunately, I just never stayed on them. Mm-hmm. I can list all the different drugs. It was horrible. And in fact, now I'm still on Lamictal. So.
Mm-hmm. Yeah. And so when you were started on the Xanax and then eventually the Klonopin, did they tell you how long they thought that you should be on it for, or?
My doctor said I needed to stay on it for life.
Okay. And what was the reason for that?
Because I had anxiety. And without it, I was going to be anxious.
Huh. And do you remember, what that felt like hearing that way back in the early 80s? Hey, you might need to be on this for the rest of your life because you have anxiety.
Well, I felt like, that was my identity. I was now the anxious, depressed person, and I had a disorder, a chemical imbalance. That was one of the things, that's what I had. That became my identity. It was the depressed person that was constantly trying to not be depressed. Mm-hmm. So the Klonopin was still working, and unlike other people, I may have had some tolerance, but I was still functioning. But the depression continued. So that's when I started taking all these different antidepressants.
Now, do you believe you had that was true, that you have a chemical imbalance?
I thought so, but I don't think that anymore. Because as soon as I started
changed?
well, when I started to taper off the Klonopin, the depression went away. I
Oh
thought
my
that was kind of
God.
interesting.
Okay. Yeah. Wow. So you think the Klonopin was actually making you feel more depressed?
It's possible.
Yeah.
I mean, it's, too much of a coincidence. I mean, sure, I have a day now and then, but, I was told that I had clinical refractory depression.
Okay. I don't want to get lost because I'm going to ask us to kind of walk forward.
Okay.
The the other thing that I'm always interested in, right at the start when people start taking meds for years to decades is how much of an, I guess, were the professionals that you saw at the time, were they encouraging you to seek non-drug therapies? Were you seeing counselors? Were they kind of digging at, hey, what could be the non-biological reasons for your depression? Was any of that going on while they were prescribing?
No, the only thing I ever did was when you went into the hospital, they had you see a psychologist. That was part of the flow of that whole trip. But in the beginning, the psychiatry was actual like interpersonal therapy, but after a while, it became about medication only, really. Yeah.
Did something, what was that? I mean, a lot of people interact with the mental health field, the first time they're there, and they might be surprised that is that all of a sudden they're just on medications. Did something about that seem off to you, or did it just seem really normal because the doctors were so comfortable? Like, do you remember your gut feeling about what was going on back then when all of a sudden you were started on these meds long term?
My gut feeling was that the psychiatrist that I saw for all those years, I don't think that the relationship was totally appropriate. I think he became very involved, and I was very unhappy in my marriage. And I think he sympathized too much, if that makes sense. It almost became like a kind of a strange relationship. And at the time, I actually needed support because my husband was not supportive at all. And here I am trying to raise two young children, and I'm depressed all the time. And he kind of fit that bill. And, just to say how bad the relationship was, he threatened to cancel me one time when I said that I wanted to die. And I sat there and begged. I can still remember sitting on the front porch begging him to not drop me. Begging.
That's absolutely crazy. Sounds like when you needed him most, he was saying, I'm going to let you go as a patient.
Now, I guess he was scared that, he might have to take some responsibility if I killed myself or something. Rather than deal with that problem, it's kind of embarrassing to think when I look back at how I just sat on the steps outside my house and just begged, pleading. Imagine doing that with a psychiatrist.
It sounds embarrassing, that they would put you in that position, because they're in a position of authority where you need their help, and that they would kind of make you feel so low like that. You said inappropriate. What was going on?
I was very unhappy in my marriage, and I don't think that was helping. And like I said, he just sympathized. He even began to tell me stuff about his personal life, the loss of his child, and all this, and it became kind of a, not a sexual thing, but a strange relationship. You know what I mean? I think he was dependent on me for something. I'm not sure what that was.
What you're talking about isn't. It's bad, and I've certainly heard about it before. But it sounds like it was leading to a dark leading to a bad place. So, but I don't want to, I mean, that's a whole nother story and a whole nother interview, but let's stay on the benzos. So you get started on them in the in the 80s. When did they start becoming a problem for you?
I didn't have a problem. I hear all these stories from people, I mean, I wasn't, I did start to have a little bit of course, I didn't start out on 3 milligrams a day. I started out on a lower dose. And when that didn't seem to do the trick, he would increase it. Mm-hmm. And in fact, the last prescription was written for 1 in the morning and 2 to 3 at night. And I never, thank God, usually never took more than just 3 a day. And, so what was the rest of that question? Now
That's okay. Let me ask some clarifying questions here. So you did you get started on 1 milligram a day? Was that the initial dose?
Yeah, well, I'm just thinking back to the Xanax. It started at 1/4, and then it went to 1/2, and then it went over to Klonopin. And it's so long ago, I can't remember if he started me. I'm assuming maybe at 1/4 and 1/2, and then 1, and then so on and so on.
And I don't know if this we're remembering back to the 80s, so I'll keep that in mind. Do you recall roughly like how many years went between dose increases? Like how long was a dose okay before you needed to up it because it wasn't doing anything anymore?
Not very long, because I think for years and years, many, many years, I was on 3 milligrams. Mm-hmm. So I think most of that time I was on, at least for, I would say 20 years on Klonopin, 3 milligrams.
Okay. And when you're taking Klonopin for that long at, what is a moderate to high dose, I'd say, was it still working for you? Did you feel that it was an effective drug?
Yes.
Okay. Yeah.
Yeah, I could travel. I went to Rome, Paris, I could do anything. And now I'm that,
Yeah. And so I guess here we are now, and, you're going through withdrawal. What happened to have, when did it stop working, or when did you decide that you wanted to come off? Tell me about that story.
Well, over the years, I guess I must have known something about, why would I need to keep taking this? And so over the years, I would casually say to him, like, maybe I should come off of this. What about that? And he would say, well, we can do that. In fact, my husband and I have kind of a joke, an ongoing thing whenever we say we can do that, because that was the thing that he would always say, we can do that. But that was up to him. I didn't know anything about that. Mm-hmm. So nothing ever happened until he was getting ready to retire.
Oh, no. Okay. Carry on. Yeah. So when he was getting ready to retire, what happened?
He gave me a list of doctors that I might be able to work with in my area. And most of them were with Kaiser, which is, I have Blue Cross. So that's, before he retired, I guess, I started to taper. He said, well, you could go by 0.5 milligram. So I went down to 2.50. Yeah, 2.50. And I wish, but I had no plan. I didn't belong to any groups. I didn't know anything about tapering. So I did that on my own. And I said, I'm feeling a little tense. And he goes, that's normal. So that's all I felt until I started to make more cuts, and then finally got involved with a Facebook group. I don't know how I did that, and then met a woman who we became friends, who helped me.
Just a few details I want to clear up. What year did you start tapering?
Around 2019.
And what was it about your doctor retiring that led to the taper being started?
Well, I had started to read things about cognitive issues and, being older and not taking stuff like that. And also I was a little concerned, I think, about the next doctor whether, they would keep me on it or not. Mm-hmm. And I'll just say that if I knew, started... if I knew that, I could have a doctor that would continue to prescribe, I probably wouldn't even be doing this.
Well, let me ask you this. Before you started tapering, was the drug having any negative impact on your life that you could observe?
No, I just think it was probably making me more depressed.
Okay. And how did you think? Well, yeah, tell us that story. How did you start to piece together that it might have been contributing to your depression?
I don't know. It's just like during the tapering, all of a sudden I realized that I wasn't having weeks and weeks of depression at a time. So I just thought, my thoughts were, that's strange. That's interesting. Of course, I do have a really good therapist, thank God. I started seeing in 2012. So I'm able to discuss all that stuff, with him and get a lot of support there too.
So sometimes people mean different things when they say depression. And so I was hoping you could just, when you noticed you were feeling different, just elaborate on that a little bit more. Like in what ways, like maybe you were more energetic or more, less anxious or had more motivation. What was the shift that you were noticing that made you say, maybe I'm less depressed now?
Because I didn't have long weeks and months of depression.
Okay. And when you say depression, could you describe it with a different word?
Clinical type depression.
Yeah. Now, is that like tearfulness or sadness, or what is like the flavor of it?
I'm just feeling dark all the time.
Mm-hmm.
Yeah.
Yeah. Okay. So walk me through your taper. What started to happen as you got lower and lower?
I just got sicker and sicker. Mm-hmm. A lot of digestive stuff, the usual tinnitus and always the stomach thing going on for the most part. Hardly a week could go by that, I don't have some kind of issue going on there. Tinnitus, shakiness. I've done the cut and hold pretty much throughout the whole. I did try water taper, and that didn't seem to work for me. So I'd always go back to the cut and hold. So after that initial 0.5 milligram cut, I started doing smaller cuts, which in retrospect is, in my opinion, is a mistake. I think that early on, if I had taken larger cuts, I could have done this faster. But that's my feeling,
Mm-hmm. And how much guidance did you have from your doctor while you were tapering?
None, because by that time he was retired. So I had found another psychiatrist who was also going to retire in 2 years. That's what he told me, and I even mentioned something to him about, like, I'd like to get off the Lamictal, and he goes, well, you're bipolar. You can't do that. So I've been through, all kinds of doctors. So I worked with him for 2 years, and I tapered a little bit there. Then I had to find another psychiatrist. I don't know, there doesn't seem to be any psychiatrists anymore. They're all older. So he was too young, and he really didn't know anything about tapering. He was telling me, you need to go by a quarter every month. And I said, no, that's not right, because by now I'm hooked up with a group, right? Mm-hmm. And I said, you can't do that. That's too fast. And so he was willing to go along with what I said. But he was just too young. I could just tell that was not a good fit. So I found another one, and he's older than I am. He's like 75.
Oh, man.
So he swears he will be able to prescribe even if he retires. He hasn't retired yet. So.
Okay. And this older psychiatrist that you're working with now, how much guidance have you gotten from him in how to safely taper off?
Well, the first thing he did when I started to see him was he started to push antidepressants. And I have found throughout my experience and gabapentin that it's better to comply. I don't advocate lying, but I actually took the scripts and actually filled them and even considered taking them because that was going to help my anxiety while I'm tapering off, right? But I never did. I just threw them away. And he wanted me to take gabapentin, and he would say, well, why don't you want to take it? So he's okay with me tapering slow, but he has said, things to me that I just know are not true. And that is, we may need to stay on a smidgen.
Mm-hmm.
How's that going to help?
Yeah. What had you experienced in the past that made you feel like you needed to fake complying with the recommendations?
Well, by the time I got to him, I realized, that, and with my own PCP, because she actually said to me one time when I was at 0.38 on Klonopin, she goes, you're so low, why don't you just jump off? Now, if I hadn't known any better, I probably would have done that. And I told her, fortunately, she's pretty low key. So I said, no, that's not going to happen. It's too much. So it shows that, regular, doctors, your PCP, they just don't know how to deprescribe. They don't understand that, 0.38, for instance, is too high to jump. So what I do is I just go along. I when I go in to see the psychiatrist, it's just for a half hour. It's just medication management. And he asks how I'm doing, and I'll say, fine. And he tells me, you're amazing. I've never seen anybody like you, your age, and you're able. So yeah. I felt like, wow, this is, he told me, he said, I've got a couple of really older people in their 80s, and I just can't get them to come off of it. And you just keep going. And I just go along with, I don't ever tell him that I'm suffering, because I did that one time and he wanted to push more medicine and to slow down. And I just want to get off of this.
Mm-hmm. Yeah. And so where are you now with your benzo dose?
I'm at 4.29 of Valium.
Okay. Well, and talk to us about the transition from Klonopin to Valium. How did that happen? What was the reason for doing that?
Because I was beginning to see in the group that a lot of people had done that, and I knew about the Ashton manual, and I thought, okay, that might be for me. So I started to do that this summer, and I didn't think the crossover was difficult at all. In fact, it might have been pretty easy to be on both those drugs at the same time, if that makes sense. And I find Valium to be really more undesirable. And if it makes sense in my head, psychologically, I still think about Klonopin. It almost makes me feel like an addict. It was my friend for all those years. And I find Valium to be heavy, depressive, and it just doesn't feel like it did the same thing as Klonopin. My mind still wants to go back to Klonopin.
Hey, just want to interrupt quickly and just say if you're enjoying the content that we're producing here, that you consider liking, subscribing, and commenting on the videos. These are the type of things that gets this video kind of pushed to broader audiences, and it can really help us.
Mm-hmm. Do you regret transitioning to Valium?
Sometimes I do, and sometimes I don't. I'll tell my husband that I wish I was still at Klonopin. At least I would understand. He does all the math, thank God, because I don't. When I think of what this would be in Klonopin, I mean, it would be like 0.19, I think. And that sounds really low to me. When I think of Valium, 4 milligrams, wow, that's actually like going up. It's not, of course, but in milligrams, it sounds like more. And it makes me feel like I've got longer to go. And I think the conclusion that I've come to is that thinking that crossing over to Valium would be faster and easier I can see that that's not going to happen. It's not really faster.
Mm-hmm.
I don't think I can go faster.
And in fact, what you've described is really common, that when people swap over to Valium, they start to feel sluggish and depressed.
Mm-hmm.
And so it's not, I know a lot of people see it in the Ashton manual and they say it's the way to go, but it just really isn't, not for everyone, and that's for sure. But I want to ask you this. I want to segue into another part. Talk to me about the impact that tapering has had on your life.
It's affected my life in ways that I never, could ever imagine. Not being able to travel, starting to have more phobias and, agoraphobic behavior. I'm not agoraphobic. I can go outside and all that, but it's really hard to get myself to do that because I'm always afraid that if I do, one of these symptoms are going to happen and I'm going to freak out or something. So, also kind of OCD behavior. Not that I was ever that way. It's just behaviors. I wouldn't call it, I don't know, just behavioral stuff. So, and refresh me again about my train of thought is.
That's okay. Yeah, I'll kind of go through some things that people may struggle with. How is being in this benzodiazepine withdrawal affected your relationships?
Well, I've told my friends that I have a medication injury. That's what I've gone to, is that's the best thing I think to say that they can understand. I don't expect people to literally understand everything. So most of my friends know about this. I don't think they really understand, but they're tolerant. My husband is very supportive. My psychologist is very supportive. And, I'm grateful for that. It's affected me like spiritually. I don't mean my lack of faith in God, but it's made it so that going to church, at least for now, is really hard. I haven't been to church in a month, so.
That's interesting. Can you share more why it has affected you spiritually?
I don't know. I hate to say it because I don't want to discourage anybody from crossing over, but I think in a way Valium has kind of taken away my motivation and changed that part of it. That's why I wonder if I should go back to Klonopin, but I'm so scared that I'm going to have some kind of stomach issue or nausea or something like that. And I just don't even want to go out. So it's made me feel, as I mentioned one time, and I'm Catholic, so it's, you're supposed to go on Sunday, but of course, I have sort of a dispensation because of the anxiety, but it's just really affected, I don't know, it's done something to me. And when I would go, and I mean, mostly I do until during Christmas, I feel like I'm always putting on a show. I push, push, push. And of course, the people in the groups tend to say, don't push yourself. Well, there might be some advantage to that, but I feel like if I don't push, I'll end up doing nothing.
And that's worse.
Really, it's really important for me to feel like I have some semblance of a normal life, which I did. I hosted Thanksgiving and hosted through Christmas and got through all that. But it does require over time a lot of, I don't mean being fake. I mean just trying really, really hard to keep a normal life.
That must feel exhausting.
It is. And that sucks the life out of you. And that's where I start to feel sad, is that it's taken away. That.
With how you're feeling currently, with the anxiety and, feeling sad. I mean, if you went and spoke to a psychiatrist or a doctor, they might say, well, Janice, obviously this is your underlying condition coming back. That's why you were on these medications in the first place. How do you know that it's not your underlying condition coming back?
In fact, this new psychiatrist that I've been seeing for 2 years now, the old one, he said that. He goes, well, when you stop this, you're just going to go right back to the anxiety you had before. And I don't believe that. I mean, I was always, if you want to go back to childhood, I was shy, very shy. And I think there was a certain amount of anxiety, but I don't think it was anything out of the norm. I think it's something that I really needed a therapist for, not medication. So I've been told all those things, anything you can imagine, I've been told. You're going to need to stay on some of it. You're going to go back and have the same problems you did that you were put on for it. And so.
Yeah. Well, I think this is a really interesting place to kind of dig in. And that is that, how do you, like you said before, I needed a therapist. In hindsight, looking back on yourself, shy, anxious, what do you think you needed a therapist to help you with that maybe would have pushed you off course from this path that you went down?
I guess someone that would listen to me and about my marriage and the unhappiness there, that, and the trouble with being depressed and trying to raise 2 children and not have a supportive husband who, more or less told me I needed to pull myself up by the bootstraps. So I think I just needed that kind of general therapy. A psychologist, that would help, somebody to discuss that stuff with. And I don't think, because the one I have now, I know he never would have recommended medication. He doesn't really believe in it. But unfortunately, it came later, but, better late than never. So he's also supportive in what I'm doing.
Sure. So looking back on it, it sounds like you just wished someone would have recognized the toll this dysfunctional marriage was taking on you, and how hard that was. Was that really the support that you needed when you were put on Xanax?
Probably, but at the same time, I have to admit that, like everybody, I think you want some relief. So when it's offered to you, in the terms of medication, I had no idea. So it was a relief for the anxiety. But if I could have been guided in another way, I think that, in fact, the therapist I have now, he is a psychologist. He's trying to help me with these new emerging agoraphobic and OCD behaviors that I've developed. So that's what we are working on right now. The very thing that the therapist could have done, if the psychiatrist, but that's not what they're in it for, I guess. I mean, when I think of all the thousands and thousands and thousands of dollars, can you imagine how much he made over 35 years?
Yeah.
But anyway.
And so were you having agoraphobia back when you were originally put on the Xanax?
No.
No. So this is all benzo withdrawal symptoms now?
Yes, and more so with Valium.
Valium. Okay. How much longer do you think it's going to take you to finish your taper?
Well, I guess I thought that maybe 6 months, but I can now understand that it might be this time next year or less. I wish that weren't true, but I don't think that this most recent cut of 2% a week is going to work out for me. it's really hard to pick apart how much are the symptoms from withdrawal and how much is, from physical things, or how much is from physical things that are caused by what the benzo has done to my body, Like, I've never thought in terms until the past year about, how I could have a brain injury, because I don't like to think of myself as having a brain injury.
Mm-hmm.
But I think if I try to go any faster, that it would just be worse. I don't see how I can do it any faster. I mean, you tell me, if I go back to 5%, and I did 8 now, I've done 8% for 2 months, tried to do 8%, and I can't tell if I'm worse or not. So going back to 5% at that rate, maybe Christmas.
Mm-hmm.
And so I feel like I've wasted, all these years of my life are wasted. And now I'm, 70, and what have I got to face? I don't have a choice.
How do you feel about the future?
Well, of course, first thing I'd like to do is be off of this, and I'd like to be one of those lucky people that get better after. I was hoping to be able to travel again. I haven't been on a plane since 2020. I used to fly all the time to California to take care of my elderly aunt. So I'd like to be able to travel. I'd like to just not be sick.
Mm-hmm.
And that's one of my main things, is to not be sick. Mm-hmm. Physically.
What's that been like? How has that changed things in your relationship since you've been sick for so long?
In my relationship with
your husband?
Oh, well, he's very, very understanding. He's, I'm very lucky. So I do have things to be grateful for. And I do. My daughter, who's, in her 40s now, she's studying to be a therapist herself, but she's very sympathetic, but I think she doesn't really understand why I can't do this faster. She said, you need to come to Colorado and get into a ketamine clinic or take mushrooms. And,
Yeah.
And I said, well, gee, I don't know about the ketamine thing. I certainly can't imagine doing mushrooms, but
Yeah.
I don't think I need that. And she goes, no, you'll see everything. It'll be so clear. But I think she doesn't quite understand why. And, she thinks that, being in the group is kind of too dark. So I have learned, I love my group. It's Benzo Warrior. But I have learned to not read trigger warnings and things like that, because, you don't want to be on there all the time looking at this stuff. It's a very good support system, but you just don't want to rely on it all the time. That's something I've learned too. So,
mm-hmm. Yeah. What do you think about that gives you hope that things are going to improve in the future?
I'm trying to have hope. I'm not feeling that way at the moment.
Mm-hmm.
But like I said, I don't have a choice. In fact, the thing I've been struggling with recently is this whole thing about, why did I ever come off of this? Everybody shares me, well, it's the right thing to do. You'll feel better. And I think, but I was feeling fine before. Of course, the problem is you might not be able to find a doctor that's going to prescribe it. And can you imagine ripping somebody off at my age, or any age, really?
It's crazy. After 35 years of use, just knocking it down by 1/4 milligram every couple of weeks. It's just madness.
I might want to sue in that case.
Yeah. Wow.
So I'm trying to have hope, and I do have hope. And I just feel like I was doing better this summer, and I don't know what's happened recently, but I do struggle with, should I go back to Klonopin? And I'm having those feelings, and, 1 minute I'll think, okay. And the next day it's like, no, just stay the course and let's just do this. But honestly, when you ask me about hope, my faith and all of that tells me that I need to have that hope. I should have that hope. I will have that hope. And I do try to have it, but it's also very difficult for me to see the end.
Talk a little bit about that. Logically, I need to be hopeful. I know people get better. I hear that. What makes it really difficult to see the end of this, or to know that to know in your heart that there's going to be a good outcome? What's stopping you from that?
Because I feel like I feel worse in a way, physically. And I'm tired. It really wears you down. It's not just, it's not just religion or faith. It's tiring. You don't really get good quality sleep. I can't even remember the last time I dreamed that I'm aware of. So all of those things make it hard I feel like I'm trying to beat the clock. Like, if I died in a couple of years, this is what I have to look forward to, is more recovery time? And that's when it's very difficult to think about, how's that going to be? It ties into, am I going to be one of the lucky ones that can just get off and I'll be better? Or am I going to have more problems? And you don't want to be thinking about that as a senior, I don't see how that's going to be. I mean, I might live to be 85 or something, but I don't know that. Nobody knows for sure, of course, when they're going to die. You could die at any time, but you just don't want to be thinking about that when you're older. I feel like I'm playing beat the clock all the time.
Do you feel like do you feel like life wouldn't be worth living if you had to live the rest of your life with the symptoms that you're having currently?
No, I think it's worth living, but you have to have hope that it will be better.
Mm-hmm.
You have to do that. Otherwise, you could go into that dark place and think, never. So you absolutely have to you have to latch on to when everything is feeling pretty good. And when that happens and when you're feeling really good, you think, wow, I can do this. Everything's great. I'm almost normal. And then, of course, things happen and you don't feel that way. So, my biggest thing to tell people is, even if you're older, you have to have hope.
Mm-hmm.
Now, would I recommend that somebody come off at this age? I don't know. You can ask me that at any time, but you have to. The biggest thing is
I'm asking you. That's a great question. What would you say to that?
I would say, how well motivated are you? It would depend on, do you know what you're doing, or do you not know anything about it? Do you have a plan? So one of the biggest regrets is that I did not have a plan, in the beginning. So make sure you have a plan. Make sure you have plenty of support. Follow that through. Get educated. So as an older person, I'm not sure that I think that it's really good for the body. I had to drop all exercise except for walking. I used to work out. I was in good shape, and now body just feels like it's. I was just telling somebody today, I even tried Botox and filler, and to try to make myself feel like because I felt really haggard,
Yeah.
And I definitely think the Botox was not a good idea, because that's sort of a neurotoxin right there. But I really only dabbled in that a tiny bit. But that's how bad I felt looking at myself. So what would I tell other people? You have to be highly motivated to do this. Yeah, what's your quality of life? In other words, do you want to have a quality of life? I'm not so sure. That's why I think about, would I do this again?
Where do you come down on that? When you were looking back on how difficult this has been, if when your first when that older doctor was retiring, said, "Oh, I've got another colleague. He's happy to just keep on prescribing this. He'll be around for a long time." What would you have done?
I think I would have stayed on it. That's how much it's changed my life.
And then I guess it just, you stay on, but you're doing well. And I guess it's a ticking time bomb, because then there's maybe you live the rest of your life with no problems, which I think is very likely for a lot of people, or else you start to have, I guess maybe there's that depression that's always kind of there, which you learnt about, or you start to have drug side effects later on when there's interactions, or I guess you worry that if one day you end up in a nursing home and that, the nurses mess up the medications, they throw you into withdrawal. I mean, I feel like with something like this, as you get older, you really need someone advocating for you. Like, so those things don't happen later on. I mean, it feels like a minefield when I think about it.
Well, that's one of the reasons I decided to go ahead and taper, because I knew about those things. By the time I'd started to taper, I knew that was a possibility, that it could, I could get dementia, which, come to find out, it does affect my thinking cognitively. And then, of course, I also go to that dark place, like, wow, am I getting dementia, or is this from the medication, or, that kind of thing. So
one thing I hear frequently from people who use the benzodiazepines for several years is they say that it impairs their ability to remember things, when they're, they look back on their life, maybe a spouse will remember something who was unmedicated, and they really struggle to do it. Do you feel like you had any difficulty consolidating memories when you were on the medications?
I do now. I wasn't aware of it at the time. The time I was on medication, I wasn't really aware of anything. Mm-hmm. I mean, there might have been something that, but the reason I think it is medication is because it didn't happen until this. And sometimes it's better than others. You talk about brain fog. I think that part of that brain fog that people have, I mean, my feeling after all this time is that if you're all wrapped up in being tired and have anxiety, and you're constantly ruminating, that affects the memory. Because I literally sometimes think that I feel like I can't think. And when all of that calms down, I'm not feeling anxious, or I take the next dose or whatever, then I seem to be okay. But I really think that people don't realize that they're not thinking because they're too nervous or have too many symptoms. And so that's what's causing their memory to be having memory problems. And of course I had ECT, but I don't know if that has anything to do with it. I certainly did lose memory after the ECT, which I was told, you'll get it back in 3 months. No, not really.
Was that the hospitalization where you ended up on Xanax, or a subsequent one?
No, that was the last I went to. Sorry, but I need to chew some gum.
Yeah, go for it. Take a minute.
The last hospital that I went to was a really nice hospital in DC. And that was the last straw with my husband at that time. He really wanted me to do that, because he thought, that'll fix her. You're going to fix. He was a fixer, you're going to fix it. So I went and had an interview with the psychiatrist there, and he said, this is what we're going to do. We're going to do 12, a series. He showed me a video. At that time, it was a VHS of this procedure. I really didn't want to do it, but I signed on for the 12 treatments. But when I came back and I was in this room with another woman, she was sitting there drooling. And I was just like, okay, can we eat now?
Yeah.
But by the time I got to I think it was the 7th or 8th treatment, and the nurse comes around to give you a shot to dry up the secretions so that you can have your ECT. She came to my room and she goes, okay, time to take the shot so we can go do this. And I said, nope, I'm done. She looked at me like I was absolutely crazy, like, oh my God, I'm going to get in trouble or something. And she goes, what do you mean? And I said, no, I don't, not doing this. I want any more treatments. Of course, they can't force you. So that was the end of that. He said, you'll just lose your memory for about 3 months surrounding the treatment. But I cannot remember lots of stuff about my son, who was my second child.
Yeah. Now that's a very common story that I hear a lot. I mean, ECT, it's concussive in a way. That's part of it is there's something about it that really has a large impact on memory for some people, and so that's just awful.
I wouldn't recommend it myself.
Yeah. No. And I mean, when you were having ECT, do you feel like a lot of the depression was still coming from, difficulties in your marriage, and all of that? Was the depression coming from something else when that was going on?
No, it didn't help at all.
Yeah.
And in fact, my psychiatrist, he sent me on to NIH to do trials. So that's when I went through the heavy duty Tegretol, Depakote. I did all those studies with NIH. And part of that was, your medication was free. Of course, nothing is really free, right? Somebody pays for that. But Depakote, Tegretol, what's the other one? Something else?
Lithium, maybe?
I think I was on lithium for about a month. I've done it all, MAO, lithium, still on Lamictal. In fact, I wonder if that's, I shouldn't be getting off that, but I was told, no, you cannot get off that either. I've done it all.
Let me ask you this. Looking back on your life, kind of you've gone through the system. I mean, all the way up to ECT, you've been in hospitals, you've been on multiple medications. Do you feel like any of that was really beneficial for you in the long run?
No. The most beneficial thing I've done is to be remarried 20 years later and to have a therapist and to be, I'm lucky to have a roof over my house and supportive people. And, I can tell by looking at you that you just can't believe this is like, you look like, wow.
Well, I definitely do believe it. I'm more just like it's crazy. I think about how much time you've spent, how much financial resources you've spent on treatments that it sounds like you regret ever having.
I regret. The only thing I don't regret is in the beginning how Xanax helped me be able to drive on interstates and the Beltway and all that, in the beginning, but that began to, go away after a while. So,
yeah.
But I didn't understand that, I was just told, well, you need to increase the dose. Yeah. But that's the only part I regret. I regret now that there's absolutely nothing that I can take that will help relieve symptoms. There is nothing.
Yeah. But, the Xanax, that's really, if we were thinking about a use case scenario for those, it's, one-off use when you have to drive somewhere maybe, or when you have to get on an airplane and you don't take it long term. That's really when you would use that medication. And so, it makes sense that was the one place where you were like, actually, it worked there for a little bit. Yeah.
I absolutely think it's okay. I'm not, I know a lot of people in the group, oh my God, I'll never take another pill. I don't feel that way. Even if I were off of this If I needed to travel, I would take some Klonopin with me or Xanax.
Yeah. So we've covered a lot now, and I think it's a good time to bring it to a close. So I want to ask, is there anything that we haven't covered that you would like to share with my audience before we wrapped up?
I guess I just want people to never go down this road that it isn't necessary. I mean, maybe for a couple of weeks, even a month, I know they say just a couple of weeks, but I certainly don't think you need it for PMS or childbirth or, postpartum depression or, I think there are certain situations, but, to just please be educated. And if you are already on it, have a plan. Definitely have a plan and understand, what you think your body can take and take into consideration whether you would be, if you just decided to stay on it, are you going to be able to find somebody that's going to keep prescribing and weigh all the things like that and whether you think it's going to hurt you cognitively or just know exactly what you're going to do. Don't just go diving into it,
Yeah. Okay. Well, I think that is really great advice. And I'm going to say thank you. Thank you so much for agreeing to come on and share your story. And I think this is going to have a big impact for anyone kind of thinking about taking these medications. So your story is really helpful. So thank you so much.
I said, thank you.